Did you know that the acid in your stomach is so powerful that it can dissolve metal? That's partly why heartburn and acid reflux hurts so much. No other organ than the stomach is equipped to deal with that much acid. It's also why not having enough stomach acid can cause digestive issues, infections, and discomfort. So, let's explore why some common digestive issues happen and the specific herbs that target them and how these specific herbs work. And if you've ever had any of these things, bloating, acid reflux, constipation, all of it, then you know you've searched the internet and you found almost any herb ever has been quoted as being good for digestion. And it's not quite true. Um, and I really want to explore the science behind how some of these herbs work and just get a little bit more clearer on what works and what doesn't and why it works, what's happening in the body. Okay, so we're going to start with bloating. What causes bloating? So, one thing, an obvious thing that causes bloating is flatulence. So you have gut dysbiosis, and you have excess gas being produced by some of the bacteria that causes bloating. Water retention can cause bloating. One thing that I always consider with bloating is that it can be an immune response. So just like when we have inflamed glands and we feel them when we're sick, when we've got like a flu or a cold or something, we can feel them and oh yes, I'm sick because these are up. This can happen in our gut as well. So we have lymphatic tissue in our gut, quite a lot of lymphatic tissue, which responds is an immune response. And this lymphatic tissue is gut-associated lymphatic tissue, and it's especially common for this to cause bloating in intolerances and allergies. Allergies you will probably know about because they're quite an extreme reaction. Intolerances like intolerances to eggs or dairy or sulfites or all of these little ingredients that are hard to pick up on, but they cause reactions in our body that are uncomfortable but they're not life changing. So you could have an intolerance to something if you continually get bloated. So those are some reasons why you might get bloated. Herbs for bloating, typically you'd be looking for aromatic herbs, commonly flowers. So the aromatic compounds in the flowers, the plants use them to obviously attract animals to be pollinated, and it's these dispersive aromatic compounds that are indicated for dispersing the gas. So commonly, and this is obviously appropriate for if your bloating is associated with excess gas. So if you're farting and burping a lot, then you want to go for the aromatic flowery herbs. So this is flowers like chamomile and orange blossom. They work really well. And also lavender and fennel seed or rosemary with those really strong aromatic compounds. Any herb that you can like rub and smell, that's the aromatic compounds. That's what you want. And these can disperse the wind and relax the stomach walls. Aromatic compounds are compounds that are so light that they rise in the air. And because obviously that's what happens in the plant, and they help increase gastric emptying and are mildly irritating to the gastric mucosa so that peristalsis is increased. So this is going to help push the gas through, thereby relieving cramping and expelling gas. Aromatic compounds can also inhibit the growth of gas-producing bacteria because they are slightly antimicrobial as well. Well, they're quite antimicrobial depending on what plant you go with. Rosemary is especially antimicrobial. Fennel and mint, they are carminative through their aromatic compounds. Calendula is antimicrobial and it can also help with the immune lymphatic element of bloating. It's a really strong lymphatic mover. Chamomile relaxes the gut wall and helps bloating by reducing spasms. So sometimes your gut's spasming around the gas. That can be really uncomfortable trying to push it through. And chamomile just helps the gut wall to relax and let it move through. Bitters are another part of these digestive aids. They relax the muscle wall. So bitters, the taste of bitter triggers your parasympathetic nervous system, which relaxes your muscles. So it does this, you have bitter receptors all the way through your gut. Not just in your tongue, you have bitters all the way through your gut, through all your organs. I don't think they're actually tasting the bitter like your tongue does, but they respond to the bitter compounds, and they relax the muscles and again allow the gas and matter to move through easier. The other part of this is that you can also get bloating with anxiety. It's that sympathetic nervous system, like stress, tension, that can cause the tension that doesn't allow things to move through. So bitters can relax that as well. And bitters are used very often in anxiety, very effectively. Okay, let's move on to acid reflux and heartburn. So what causes acid reflux and heartburn? There is a misconception, or not a misconception, but a misunderstanding that acid reflux must be too much acid. And that's actually what common prescription drugs are doing, PPIs. They're preventing the production of acid. Too much acid is actually quite rare, or considered to be quite rare in the integrative medicine space. It's more common to have not enough acid. There's more triggers in our world and our environment that's going to make not enough acid as opposed to too much acid. So not enough acid, the production is reduced during stress and hormonal imbalances, including low thyroid hormone. Estrogen and progesterone can mess with stomach acid production. Stress is just a really big one as well. Like that can definitely mess with our hormones, which then secondarily mess with the acid, but also directly mess with the acid. And there is a theory that low stomach acid triggers the lower esophageal sphincter at the bottom to relax and allow acid to reflux, to come back up. So it's a complex relationship of hormone signaling, and it's not a complete picture, really. So it's just something to consider, that it might not be that you want to reduce acid too much. So sometimes people will use stuff like calcium carbonate, like over-the-counter stuff, like antacids, which obviously offer effective relief, but just consider long term that if you're reducing this stomach acid, then could lead to other problems down the line. SIBO can also lead to acid reflux, potentially through intra-abdominal pressure from excess gas. So SIBO is small intestinal bacteria overgrowth, and if the small intestine's got all this gas in it, like putting pressure on the stomach, that can cause the reflux to come back up. It's another hypothesis. I don't think that's been proven. Estrogen dominance, like we said before, can disrupt digestion and stomach acid production, as well as low thyroid, because T3 and T4 have protective effects on the mucosa. So when they're low, you lose that protective effect. And basically anything that marks high stress for the body. So stomach acid is primarily regulated by the parasympathetic nervous system, which is a hormonal and physiological state. So a hormonal and physiological state that indicates stress will reduce that stomach acid production because you're not in that parasympathetic nervous system anymore. Some herbs for acid reflux and heartburn. There's a theory, or like a common, and I do this myself, and it helps for other reasons. I don't have acid reflux and heartburn, but there's a common folk remedy that a teaspoon of apple cider vinegar before meals will support stomach acid production and acid reflux. There's no scientific evidence for this, but lots of people swear by it. Helps me with other digestive issues. Just be careful to dilute that apple cider vinegar in water, because it is vinegar and it can affect the coating on your teeth, the enamel on your teeth, and burn, really. And that's not what you want if you're trying to get rid of acid reflux. Okay, there's some other herbs, some more gentle, nourishing herbs that are really going to help the stomach. Slippery elm is a really traditional, popular one. Works through its mucilaginous action. So if you've ever seen slippery elm, it's when you mix it with water, it's really slippery, and it coats the inflamed tissue just like an oat compress. So for example, I've had a cut on my hand. I put some oats on there, and so soothing, really just relaxes the inflamed, angry tissue. This is what slippery elm is going to do inside your gut. Probably oats to some degree, potentially, although your gut still has to break down the compounds. Oats can be quite hard to digest for some people, so I'd stick to slippery elm. Marshmallow root is another one. Research does show that it may improve wound healing by killing gram-positive bacteria, so it can improve wound healing through. It's also a really mucilaginous, really soothing, cooling, calming herb, but it's also been shown to kill gram-positive bacteria, so it can help that sort of wound healing. The other thing that I didn't mention here is that H. pylori kind of can come into acid reflux, and it's, I can't remember the exact, something like 1 in 4 people are affected by H. pylori, but they don't experience any symptoms. But it can cause damage in the stomach, which causes acid reflux. So this is where marshmallow root might come in, might support the healing of the stomach. Marshmallow root may also stimulate anti-inflammatory compounds, and one old study from 2014 showed that it might act as a pain reliever too. I think it probably acts as a pain reliever through the way that it heals the wounds. Licorice root is another one. One study from 2013 looked at glycerinic acid, which is from glycerinic acid, which is from licorice. So they've really extracted this, paired with bilberry, anthocyanate, and alginic acid, and found significant improvement in symptoms of patients with acid reflux. Another trial found that licorice improved symptoms of functional dyspepsia. So there is quite a lot of, a fair amount of research on licorice being beneficial for acid reflux and heartburn through this glycerinic acid, although in herbal medicine we'd want to use the whole plant. And licorice root is quite accessible, really. I mean, all of these are quite accessible, so you can buy slippery elm. Slippery elm is endangered, so please be careful where you're getting it from, and also you can just use any elm powder. Any elm powder will work the same, so that might be something to be conscious of. Marshmallow root is very widely available. You just want to either get that in a powder as well, or boil the roots, decoct the roots for 10 minutes or more even, because it's that long hot extraction that's going to get all of the good stuff out. Licorice root, same thing. You can buy licorice root and you can decoct it for probably the same amount of time. You can even put the licorice and the marshmallow in together. That'd be really nice, and then drink that. Okay, constipation next. Talk about constipation. So what causes constipation? Chronic tissue tension, which could be linked to stress, anxiety. Also dehydration can lead to that tension, and not enough moisture entering the cells. So that's another aspect here, is perhaps you are drinking enough, you feel like you're drinking enough, but your cells just aren't taking up that water. And in that case, it might be worth trying drinking the water with some electrolytes or some salt, and that can help the water to cross through and get into the cells. They suck them up. Water follows salt. I think that's what Matthew Wood always says. So chronic tension coming from any of those things can lead to that constipation, because obviously the muscle is so not gonna let go of anything. So in that sense, we'd work with anxiolytics, we'd work with nervine relaxants to relax the muscles. Could be weak or poor vagal tone, could be lack of fibre. That's a really common one, just because of our diets these days. We have much less fibre, and fibre is really one of the only things that's going to pull that waste through the final phase of detox. Nothing else will really allow the stools to bulk and pass. That's why a lot of laxatives are, well, you have stimulant laxatives and you have osmotic and I've forgotten the other one, but these fibrous bulk laxatives, there you go. bulk laxatives. These type of laxatives add bulk to the stools, they add fibre, and that's what's going to help pull the laxatives through. You also get stimulant laxatives, which stimulate the muscles to contract. They're quite aggressive and I don't recommend them. You have herbal stimulant laxatives, like senna is a really popular one, but I really don't recommend it long term because you end up either damaging the tissue, or your body doesn't like know how to do it by itself anymore. You become dependent on them. So it's worth trying this route of fibre and bulk laxatives first. And yeah, maybe we'll get onto osmotic laxatives as well can work. I think psyllium husk, it can be an osmotic laxative in the sense that it draws moisture into the stools to help it become soft enough to pass through. So that could come back to the dehydration element. We'll talk about psyllium husk in a minute. So lack of fibre, you can consider adding more fibre to your diet. More soluble fibre, more fermentable fibre can also help as well. High estrogen is linked to constipation, so there's this hormonal aspect as well. When it's linked to higher estrogen, it can become a sort of a vicious cycle, because as the stools is not evacuated, then estrogen can be reabsorbed in the small intestine, and then you get higher estrogen again. So it's a bit of a vicious cycle. We want that stools to keep moving. Yeah, and that's the other thing is stools that's not moving can add to hormonal imbalances because of the reabsorption. Then another factor is intestinal methanogen overgrowth, which is a type of SIBO, or it's linked to SIBO. SIBO is, so you have SIBO and then IMO, which is this intestinal methanogen overgrowth, and you have three others. There's 5 categories. SIBO is linked to diarrhea. So typically one of the symptoms of SIBO is diarrhea. One of the symptoms of IMO is constipation. So they otherwise present really similarly. So you might think that you have a bacterial overgrowth or some sort of candida or something like this. And the way that you tell them apart, SIBO, typically diarrhea, IMO, typically constipation. And you treat them slightly differently. And that would show up on a breath test. So you obviously intestinal methanogen overgrowth, you're going to test for methane, that would be raised. SIBO, you're going to test for, I can't remember the word, but yeah, there's a difference there. So herbs for constipation, we talked a little bit about those laxatives. To improve tissue hydration, we talked about that. You can use electrolytes and salt with your water to really improve that hydration of the tissues. Fibre as well, we've talked about that, so that absorbs the water and creates the bulk of the stool. Some ideas for fibrous foods include beans and oats and vegetables, and plantain husk is fibrous as well, and that you would use as this really disgusting drink, gelatinous drink. Not pleasant, but it gets the job done. Sometimes more fibre, a little warning, can make it worse though, normally because of poor hydration. In this case, perhaps having the fibre, if you're having plantain husk, maybe have it with some marshmallow root drink to support the water, the hydration there. Marshmallow root helps constipation through its mucilaginous effect, but if you take it as the root powder, as a fermentable fibre, that increases colon transit time. So you want to take that as a root powder to get that mucilaginous effect, because it's in the fibre. Psyllium husk, as we said, is a bulk laxative. It's sometimes used in hospitals. It's also been suggested to stimulate acetylcholine receptors and act as a neurological gut stimulant, which is interesting. Not something I would ever consider directly for marshmallow root, but there has been some small studies suggesting that psyllium husk, has this neurological stimulating effect. Rumex crispus is a stimulant laxative, and it comes sort of in line with senna. You would only want to use it in extreme cases, and not very much. 2 ml, maybe less, probably less. Yeah, 2 ml, 1 ml, and yeah, that will get things moving. But as I said before, just be very careful with how much you use and how long you use it for. If it's IMO, like we said before, then a protocol with antimicrobial herbs first might help, plus probiotics afterwards to follow. Prebiotics in IBS and SIBO and all of this have been shown to not have any effect, really. They've been shown to be fairly ineffective. Probiotics, however, have shown to be beneficial. So there's a whole protocol associated with SIBO and IMO, and I'm not going to talk about that today, but it's worth just noticing that if the constipation is coming from this issue, then you want to resolve that issue and not just constantly stimulate yourself to be having a bowel movement. So let's talk about leaky gut and IBS. So what causes leaky gut? It's a bit of a buzzword at the moment. Basically, it's a degradation of the mucosal wall anywhere along the gut, which can lead to an array of immune reactions, including bloating, gas, discomfort. The holes or the damage can come from antibiotics and gut dysbiosis. This can come from poor diet, can come from the environment, toxins. Could be a further stage, like a progressed stage of unmanaged IBS and IBD. So obviously, yeah, that can lead to the damage if that IBS and that IBD is not dealt with. Can be a further stage of intolerances and allergies, any chronic inflammation in the gut, and in some cases, vitamin deficiencies can cause this damage as well. Specifically, I think the research has been done on vitamin A and vitamin D. I think vitamin A deficiency is quite rare in developed countries, but vitamin D, as we know, is quite common deficiency. Patching up leaky gut again requires a whole protocol, just like that SIBO. So I won't go into that protocol today, but plantain leaf and marshmallow powder can help, and calendula and elecampane can also be beneficial for gut-focused immune support and healing. So leaky gut and IBS can cause constipation through various different ways, like we mentioned some of the ones before. Herbs for leaky gut that you could use independent of and as well as any protocol that you decide to do to heal that leaky gut, remembering that leaky gut is not a medically recognized condition. It's recognized in integrative and functional medicine, but it's not a diagnosable thing in orthodox Western medicine at the moment. So some herbs for leaky gut that you could lean on. We've got medicinal mushrooms. They can support the gut with their prebiotic polysaccharides, so they're really prebiotic, even though we said that prebiotics have been proven to be fairly ineffective for SIBO and IBS. I think they're more beneficial for leaky gut. So medicinal mushrooms, they're also immunomodulatory, and they can help the autoimmune element of leaky gut. They're really immunomodulatory. So if you have any constant immune issues going on, then mushrooms are your best bet. They've got all those beta glucagons and polysaccharides that help the immune system to modulate. So that can help any autoimmune aspect of leaky gut. In a 2022 paper, Schisandra chinensis was shown to improve intestinal permeability and regulate some markers involved in smooth muscle contraction, and also regulate inflammation-related signalling. So Schisandra is great. It's an adaptogen. It's a tonic, and it's really sweet and sour, and it's considered like the herb of all flavors, all 5 flavors in Chinese medicine, really balancing. and really nourishing as well. Other plants that have been studied in the literature in leaky gut include green and black tea for its alleviation of dysbacteriosis. So the reason that they're looking at green and black tea is not something I typically recommend, but it's for balancing that gut microbiome out. Green tea especially has been shown to be prebiotic to lots of beneficial bacteria in our gut. Hibiscus has been studied for its effect in suppressing inflammatory cytokines. Licorice root, we're coming back to that licorice root again, for its ability to maintain the integrity of the epithelium, so that's the bit that's damaged in the leaky gut. Marshmallow root decreases TNF alpha, and this is a inflammatory cytokine that is produced by macrophages during inflammation and immune reactions. So it improves levels of this and supports wound healing. And finally, plantain for its local wound healing effect. Plantain is super at stitching cells back up. You can use it topically as well. Okay, I would also recommend calendula on top of all of those. I couldn't find any literature on calendula, but we know that it is very immunomodulating, very good for the lymphatic system, and it has a good beneficial wound healing effect as well. Okay, so hopefully that helps. Stay hydrated, eat your fibre, but not too much, and yeah, get your aromatic herbs in there, and you'll be okay. And let me know if there's any questions in the comments.